Hello everyone, my name is Dr. Respicious Boniface. I'm going to talk about trauma team training in Tanzania. I work with Muhimbili Orthopedic Institute, Muhimbili University of Health and Allied Sciences, Injury Control Center Tanzania. I also work with the Injury Prevention Initiative for Africa, IFA, the Secretary General. This is a map of our country, Tanzania. Our neighbors are Kenya, Uganda, Rwanda, Burundi, Democratic Republic of Congo, Zambia, Malawi, Mozambique, and the Indian Ocean. Tanzania is an area of about 945,087 square kilometers. It has a population of about 60 million people. It is one of the poor economies in the world. What's the importance of injury in Tanzania? Injuries represent a significant cause of morbidity and mortality in the world. And the problem is growing rapidly in sub-Saharan Africa, including Tanzania. And much of the injury burden we face is due to road traffic crash. Road traffic crash account for almost 50% of injuries seen at our hospitals in Tanzania. Motorcycles, two-wheelers, account for 50% of road traffic crashes. And the majority of injury victims sustain long bone fractures, multiple injuries, and head injuries. Other common causes of injury include falls, assault, and animal bite. Hence the need for preventive measure to prevent these injuries from occurring. And there is also a need to improve patient treatment and care. So what's the importance of trauma team training as part of capacity building? A bit of healthcare status in Tanzania. Trauma care is not a priority. We have limited facilities in terms of emergency room, operating room, and intensive care unit. We have insufficient number of human resource and expertise. Those handling patients in many hospitals are not properly trained. So in response to this, Muhimbili Orthopedic Institute and the Canadian Network for International Surgery, CNIS, established the Injury Control Center Tanzania, ICCT, in February 2005. The ICCT objectives were to determine the magnitude of trauma in Tanzania through injury surveillance, trauma registries, and to improve initial management of injured patients through trauma team training program to medical personnel working in rural district and the regional hospitals of Tanzania. It's a low-cost course designed to teach a multidisciplinary team approach to trauma patient care. The emphasis is on teamwork, not individual. It is a 3-day course, a class of about 20 participants, involving lectures and skill sessions. Implementation of trauma team training course. CNIS and the team from McGill University conducted the first TTT instructors course amongst 17 specialists at MOI in 16th June 2005. Thanks to Dr. Leti and thanks to Dr. Tarek for this. Instructors were trained from different areas including general surgery, anesthesia, orthopedic surgery, and neurosurgery. These subsequently became local facilitators for the TTT program in Tanzania. ICCT has so far conducted 34 TTT courses in various districts in the regional hospitals since its introduction in Tanzania. A total of 674 medical personnel, including doctors, clinical officers, anesthetists, and nurses, have successfully completed the program in various districts and the regional hospitals. What's the future of the TTT in the country, in our country, Tanzania? It's an important program in our limited resource sector. Hence, it has to be sustained. We try to incorporate it in our curriculums of training institution, MDs, clinical officers, and maybe nursing. Also, we need to sensitize our government to support the program. We still ask for more support from big institutions, NGOs like McGill University and CNS to sustain the program. Thank you very much for listening.